Okay. Welcome back. Welcome back. Thank you. Wow. What a powerful set of lab sessions, generating great debate and dialogue around these important topics. Let me give you a couple of examples. I went to the measurement session, and I walked in, and the table was vociferously debating just the first stage of the measurement exercise, just about a decision whether to source internally, inside the country in which the organization was operating, or whether to source it externally. And the team was having trouble coming to a consensus just in the first stage of that exercise. I saw the team rather democratically say to themselves, okay, let's just vote. We'll decide by a vote which selection we should make. Malcolm was pushing them, saying, your board needs to know an answer. You got to vote. So they dutifully raised their hand, counted it off. 1, 2, 3, 4, 5. So, okay, who wants to source it, have it imported? Raise your hand. 1, 2, 3, 4, 5. Uh-oh. Hard to come to consensus. I was also in the brand session where those groups were really engaged in a great conversation about linking shared value with brand value. And then I walked over to measurement right in time for somebody to stand up and say, my board doesn't want to hear anything about the creation of brand value connected to shared value. That's not good enough. Wonderful. I'll tell you what, I love these conversations. I think it's exactly as a community where we ought to be. Let me point out another example. Thank you so much for using the Pigeonhole technology. The questions that came through this morning for Darren and for Kathleen, wonderful. Thank you. Here's my promise to all of you. Your Pigeonhole questions will not disappear into the pigeonhole. That's right. Sharedvalue.org, we're going to answer all of those questions, okay? And I know it always feels like in environments like this, you don't have quite enough time to really get answered what you want. But we're going to take all of those great questions and the ones we get this afternoon, and we are going to answer them through sharedvalue.org. So thank you, and please keep them coming. Now this afternoon, we have a powerful last set of folks who are coming up, and we're going to listen to. We have, starting with Dr. Allan Pamba from GSK with a story of inspiration. Our last storyteller slot. Really looking forward to hearing from Dr. Pamba. Then we're going to have an investor panel, comes up every year, and we're going to see and take a real look at how far we've come, and I think practically speaking, an area where we still have work to do. And then to round out the day, before we hear from Mark Kramer in a final close, we're going to hear from Jeremy Hymans of Purpose, who's going to tell us about what it takes to create a movement and about how power structures are shifting in the world and how that can help support and drive all of our work. So without further ado, please join me with a warm welcome for Dr. Allan Pamba.
Thank you. Can you hear me at the back? Okay, so maybe to start off by saying I'm really pleased to be here. And as I tell my story, you'll realize I'm pleased to be here on many levels. I think the first one was my arrival at JFK on Monday, flight from Kenya, and had a very interesting conversation with the border official as I was coming in. I don't know about you guys, but every time I get into a country, and I travel a lot, Uganda, Tanzania, Nigeria, I'm always a little bit nervous before I cross the border. And I was when I arrived here. So I get to the guy and I give him my passport, and he looks at me, looks down, doesn't look up ever again. First question, what do you want in the United States? And I'm thinking, what do I want in the United States? Should I be wanting something in America? Is it a trick question? Anyway, I gave him the right answer, which was, I'm attending a very important conference on shared value. Didn't mean anything to him. Moved on to the next question, where are you from? So where am I from? He's holding my passport. And I had to look at it and think, the bold letters on the front of the passport, do they say Pluto or something? So I read it out to him. I said, I'm from Kenya, sir. And then the third question followed briskly. Where is that? Now, when you get asked where your country is from, you know you come from a really tiny country. that has done nothing but contribute a president to the United States of America. He let me in. He let me in, so I'm really happy to be here. I'm really excited to be here. Now, back to my story. I think the first thing to say is I joined the pharmaceutical industry 10 years ago as a young physician, and I joined it not because I liked it, but because I hated it. There is a contradiction in that statement, and it's going to become clear to you as I give you my story. I grew up in a typical African village, which, as you can imagine, green, lush, out in the bushes. We had no running water, no electricity, didn't have to go to school. I love that. And, but we also didn't have any healthcare facilities. The environment that I grew up in was plagued by ignorance and disease. And that was my experience growing up with my relatives and friends who lived in my environment. We were mostly afraid. I remember as a little boy, I was mostly afraid of the big animals that we saw, you know, hyenas and leopards, because we had those around us. And we found a way of coexisting with them generally peacefully. What we did know is the biggest enemy was the mosquitoes, the tiny little mosquitoes that beat us, because back then, malaria killed 1 million people every year. With all the progress we've made, 600,000 children still die from malaria, majority of those in sub-Saharan Africa. Now, if you think about that number, it's just a statistic, but it's significant. If a jumbo jet comes down, that's 500 people, right? Crush. 600,000 people dying, that's about 1,000 jumbo jets crashing quietly every year. Nobody really gets to hear this because they don't have a voice. We had malnutrition, we had pneumonia, we had a bunch of things that meant when I was little, my probability of reaching my 5th birthday was no less than 30%. I didn't know that. It was acceptable in the environment I grew in, but that was the probability. So I'm glad to be standing here today. The other key statistic is my probability of getting a full education through to university was less than 1%. That was the reality, you know, less than 1%. Now, to cut a long story short, through a mix of good luck, hard work, and lots of goodwill and support from different people along my career journey, I ended up becoming a doctor and starting to work in my part of the world. Now, you have to remember that that part of the world hadn't changed very much between me being a child and me being a physician. Africa, even today, still has to bear 24% of the global health burden, with just 1% of the global health budget and 3% of the global health workforce. It is yet again just another statistic, but if you leave behind that statistic, I can tell you it's as real as a heart attack. There's over 1 billion people today in the continent. Majority of them leave behind that statistic. You know, that is the reality that we live in. So coming out of medical school as a young physician, you know how you are when you're still young and energetic, you feel you're going to change the world and do everything. And this is what changed my life, the HIV/AIDS epidemic. I don't know how many of you followed that narrative, but it was very, very powerful. At the peak of the epidemic in the year 2000, 20 million people had died from HIV/AIDS. 40 million people lived with this disease. Over 80% of those lived on my part of the world. Now, as a young physician, I found myself trying to treat a disease that was not treatable. Most of us who came out of medical school at that time, this thing hit us like a hammer in the head. You know, you have patients that you are seeing, you know what to do, you know more or less what to do, but you haven't got the tools to deal with this. And what was very upsetting was that around the year 2000, some of the early treatments were coming out. And so we had patients here in Europe who were having a Lazarus effect with the new HIV/AIDS medicines. I just set up a HIV clinic. I had 300 patients that I was seeing. And I got to know many of them very well. They were mostly young people, below the age of 25, I'd say. Majority were between 18 and 21, and a few children as well. And what became very clear to me was that I was increasingly seeing this statistic that I shared with you, 20 million people dying. I signed the death certificates of a few hundreds of those. There were people that I had conversations with, some of them on their deathbed, and that is quite sobering. And actually, 2 of them were my own brothers who I grew up with and were lucky enough to survive the statistics that I told you up until this epidemic came. So as a physician, I started asking myself, why did we train? Why do we do what we do? Why is the world so different? And the challenge that I saw was that whilst the drugs that we needed were coming out, there was a one-size-fits-all business model driving the supply of those drugs. $15,000 a patient a year, take it or leave it. It's one model. Now, clearly, that changes how you think if you think about things globally, which at that stage I was beginning to, because it's a very sobering thing when you watch people die, day after day. So what happened at that point, for those of you who remember the history, is that South Africa decided to procure these medicines from India, from a generic manufacturer who was going to sell it to them at $300 a patient a year. And the result of that was that the wrath of the pharmaceutical industry descended on Mandela. Now, the interesting thing was that this case was not to be decided in a court of law. It was settled in the court of public opinion, as should have been. We had people rioting, people living here, not even in Africa, coming to the gates of pharmaceutical companies and saying, this cannot be. Now, the interesting thing is, it's at that stage that I left my country, packed my bags, went to London, and I decided to join GSK, it's a pharmaceutical company. Of course, many of my friends were very confused by what I was doing. It looks crazy, how can you go and work for the enemy? I think we have choices, in life you have choices. You could walk away from a problem, throw stones from outside, or you could say, you know what, I'm going to open the door, step in, and see what evil there is in there. It might kill me, but I might also survive, and I might also bring a perspective that's not there. I can't claim, of course, credit for all the change that's happened in the industry, but the honest truth is in the last 10 years that I've been with the pharmaceutical industry and with GSK in particular, I've watched tremendous change in how the industry is approaching the challenges of healthcare, especially in the developing world. There are many things that I could talk about, which I've observed specifically in my company, in GSK. But the one thing that has most excited me is something that we did 5 years ago, which was to change our business model in the developing world. There are 4 things we did, which I think are driving a bigger change faster in my part of the world than otherwise will be. So the first one is we brought all our businesses in the least developed countries under one umbrella and shifted the focus from pure profit to volume. We want to drive a high volume, low margin business, as should have always been in that part of the world. It is still a business, there are still margins, but we're after volume. The second thing we did, we decided to incentivize business leaders on volume targets, not just profit. As a business leader in East Africa now, the more volume I can get of medicines and vaccines to the people of East Africa, the more I'm rewarded by my company, which is the way it should be, really. The third thing was we further augmented our tiered pricing principle, which meant that when we launch a new product in the USA today, we're going to launch it in Africa the same year, not 10 or 20 years later. We just launched one of the best HIV medicines ever developed in Europe this year, and I'm glad to say it's already launched in Nairobi, and we're priced right. People can access that product. And the fourth thing we did was we made a decision that in the least developed countries of the world, 20% of the profits that we make go back into healthcare infrastructure. And with that investment so far, we're working with 3 credible organizations, AMREF, Care International, and Save the Children. We've trained 25,000 frontline health workers. And this is an army of health workers who are having a fantastic impact in parts of the world where a woman probably comes in contact with a health worker once, a whole life, But more importantly, this is a reinvestment of the profits that I make in East Africa, for example. These frontline health workers will deliver my medicines one day. It's not a free thing that we're doing, but it's something that answers an immediate need in the part of the world, but also answers a future need for us in terms of getting our medicines where we need to get them. In the short 5 years we've done this, we've had 2 effects. One, we've doubled the volume of medicines that we get to developing countries, which is incredibly exciting. We are now working with an ambition to reach 80% of the populations in Africa. We have the portfolio. We just need to continue keeping the will to get there. It will also be interesting to say that our company has been #1 in the Access to Medicines Index, which is the biggest league table that scores leading pharmaceutical companies on how well we get our medicines and vaccines to developing countries. We've been #1 more than 3 times now. It's run every 2 years. That's why I'm still there 10 years on. Now, if you think about creation of shared value, there are 2 key things that this brings to a corporation. I think the first one is obvious. It's profit. You're going to do well. You're going to do better, you know. The second one, in my opinion, is you actually secure your license to exist and to operate. A license which we get from society, but which we always often very quickly forget the minute we start doing well. But it can go away like that. We saw the banking crisis in 2008 and 2009. We saw the discussion that happened around that. We've had challenges in the pharmaceutical industry. So creating shared value, I think, gives you that longevity as an institution, allows you to plan 100 years ahead with fair certainty that you're going to be there. I really liked the story of Discovery Health yesterday. I hadn't had it before. And I was thinking, you know what, if Discovery Health had any kind of problem that challenged their existence or threatened their existence, the support they get will come from society. Society that sees the benefit that that company brings to everyone. I don't know about you, but for me, I want to make money. I want to make tons of money in my life. I came from poverty, so I know I need to make money, you know. I don't know what I'm going to do with it, but I know I want to make a lot of money. I'm sure it's true for everyone in this room. But here's the deal. I want to make that money, but have a good balance between the money I've made and the value I've brought to other people in making that money. I think it's very easy to get a disbalance between the two, an imbalance between the two. When you have that imbalance, you've got profits that are riding, you know, way high, but the value that you bring is always questionable. I think you're walking a tightrope and a very short path. And the opportunity we have is to drive organizations that have a long-term view to the solutions that we bring in the environments where we work. Where I grew up, as I described to you, we were not within the radar of most of the companies in this room. We were not within the radar of GSK, we were not within the radar of banking institutions, we were not within the radar of insurances. You know, I used to hang out with my grandfather who would take care of our cows, and we thought we were wealthy. We had tons of cows, we had goats, we had crops. But we weren't included in the formal economy. We couldn't trade. And so we weren't attractive to anyone developing a new HIV drug that could make a difference to our lives, or a malaria vaccine, or a treatment for pneumonia. And that's because people thought about the world differently back then. And I think the discussion we're having today here, or in the last couple of days that we've been here, is driving a different mindset, is looking to bring into the fold populations that are otherwise neglected because no one sees the opportunity that they bring. I went back to Africa last December after 10 years in the UK, 10 winters, that's how I look at it, done my time. And it's great to be back in Kenya. It's sunny every day. People smile a lot more. There's a lot more problems. I'm on the sharp end of the problems that I try to solve working with our company from the center in London. But it's exciting to be at the cutting edge of solutions. And making the journey here from Kenya to come and participate in this discussion, I did a lot of reflection on what am I going to take back in what I do for GSK and running the businesses in East Africa. How are we going to make sure that, whereas we're going to double the volume of medicines and vaccines again in the next 5 years, we triple it as a result of the conversations that we're having here. And I've got a few ideas on how we're going to do that. And my only hope is that all of us, going back, think about that, think about what we do in the same way. I don't know about your careers, but certainly when I think about my career, every day it feels very short. There's less and less time to do a lot and a lot, when you look around you. And we're faced with choices and we make decisions, but we never spare a thought to imagine what's the impact of the decision I made today? How far does it go? And I challenge you to think about that, because when I look at the people around this room, I think in one day, if you all made decisions in your respective roles, probably 1 billion people are impacted in one way or another by those decisions. But we never think about that. The decisions made on boardrooms very quickly, decisions made on small group discussions and so on. The whole concept of shared value, the impact that that has, if it takes and flows through across all corporations, is massive. And it could be a 5-second decision by a chief exec who says, well, you know what, this doesn't apply to my organization. So I speak very passionately about this because of the history that I gave you. I don't forget where I grew up from, and I just went back there, so it's acutely clear again for me. And I think if they had their way, there'll probably be 1 billion people standing here on stage wanting to tell you their story. And all I can do is tell one story that probably speaks for a couple of billions. Thank you very much.
I'm guessing I'm not the only one in the room with a little bit of a chill right now. Thank you, Dr. Pamba. What an inspiring story. Thank you, really. And I think everyone else has seen the same thing.